Welcome to the deep dive.
Great to be here.
So today we're tackling something really fundamental to your health, your urological system. We've got some, well, pretty interesting material here. Basically, learning objectives from a pathophysiology final exam, all about urological disorders.
Right. So think of this as like a quick way to get up to speed.
Exactly. A fast track to really understanding how your urinary system is supposed to work.
And what can go wrong?
Yeah, and the basics of how those issues are spotted and, managed, getting you well-informed fast.
And we're using these specific learning objectives as our guide. It's about getting a real grasp, not just memorizing facts.
So let's break it down, how it functions normally, common problems, the signals your body sends.
And how doctors figure it out and treat it.
Okay, let's jump in. The basics first. How it's supposed to work. 4 key parts, right?
Yep. Kidneys, ureters, bladder, and urethra.
Kidneys. They're like the MVPs here, aren't they? The body's main purification plant.
Absolutely. They do so much. Filtering waste from your blood, that's the big one.
But also regulating electrolytes and fluid balance.
Exactly. Keeping everything in that perfect balance inside. Really crucial stuff.
Okay, so kidneys filter, then the ureters. They're just the plumbing, basically.
Pretty much. Simple but essential tubes carrying the urine that the kidneys make.
Down to the bladder.
Right.
And the bladder is the holding tank, the storage unit.
Yeah. It's amazing how it stretches to hold urine until you decide it's time. Your body's own reservoir.
And finally, the urethra, that's the exit route.
The channel out of the body. So yeah, a coordinated 4-part system.
Now, there's a number mentioned, a benchmark for kidney function, normal urine output.
Ah, yes. A healthy kidney system usually puts out around 30 milliliters an hour.
Okay, 30 mils.
Which works out to roughly 1,500 milliliters, so 1.5 liters over a whole day.
And that number is significant.
Very significant. It's a key indicator of how well those kidneys are doing their filtering job. Consistent changes, even small ones.
Could be an early warning sign.
Exactly. Before other symptoms might even show up.
Yeah.
So, yeah, that output volume tells us a lot.
Okay, so that's the system running smoothly. But what happens when things go wrong? What is urological dysfunction?
Well, in simple terms, it's just when any part of that process, the filtering, the storing, or the eliminating of urine, isn't working right.
Or an impairment.
Yes.
Yeah.
And the sources point to, well, a few different root causes. It could be anatomical, something wrong with the structure.
Or neurological, like nerve signals.
Precisely. Or an infection causing trouble. Or even some kind of blockage stopping the flow.
And the symptoms people might experience, they can vary a lot, can't they?
They really can. The objectives list things like retention, where you can't empty your bladder fully.
The opposite of incontinence, then.
Right. Incontinence is losing control. Then there's hematuria, that's blood in the urine.
Which sounds serious.
Dude, definitely needs checking out.
Right?
And dysuria, pain or discomfort when you urinate. Things you shouldn't ignore.
Definitely not. So, drilling down into the causes, what are the common culprits?
Infections are a big one. Standard UTIs, urinary tract infections.
Right.
Or pyelonephritis, which is more serious, an infection up in the kidneys themselves.
Okay. What else? Obstructions.
Yes, blockages.
Okay.
Kidney stones are a classic. Nephrolithiasis is the technical term.
Painful, I hear.
Extremely. Then there's BPH, benign prostatic hyperplasia.
That's the enlarged prostate in men.
Exactly.
Yeah.
Not cancerous, but it can squeeze the urethra and cause problems. And also strictures, basically narrowings in the urinary tract.
Got it. Inflammation is another category.
Like cystitis, that's bladder inflammation.
Yeah.
Or prostatitis in the prostate.
And glomerulonephritis, that sounds complicated.
It affects the glomeruli, the tiny filters inside the kidneys.
Mhm.
Think of them like microscopic coffee filters getting inflamed.
Ah, okay. And you mentioned neurological causes too.
Yeah, neurogenic bladder. That's when nerve damage messes with bladder control, like from a spinal cord injury or maybe MS, multiple sclerosis.
And unfortunately, sometimes it's more serious things.
Yes, malignancies have to be considered. Cancers of the bladder, prostate, or kidney can all impact function significantly.
And finally, trauma. Just physical injury.
Right. A direct injury to the bladder or urethra can cause obvious problems. So yeah, quite a range of possibilities.
So we know it can go wrong. How does the body actually signal these issues? The material mentions LUTS, lower urinary tract symptoms.
That's right. LUTS primarily point to problems with the bladder or urethra.
Okay, what kind of symptoms fall under LUTS?
Things like frequency having to go way more often than usual.
Urgency, too, that sudden gotta-go feeling.
Exactly. And dysuria, the pain we mentioned. Hesitancy, like trouble getting the stream started.
And nocturia, waking up at night.
Yes, needed to get up multiple times overnight to urinate. All classic LUTS. Red flags for the lower tract.
And incontinence fits here too. The objectives list, 4 types: stress, urge, overflow, functional.
That's right. Can I quickly break those down?
Please do.
Okay, so stress incontinence is leakage when you, like, cough, sneeze, or lift something heavy, often due to weak pelvic floor muscles.
Makes sense. Urge.
Urge incontinence is that sudden, intense urge followed almost immediately by leakage. Think overactive bladder muscles.
Got it. Overflow.
Overflow happens when the bladder doesn't empty properly, so it gets too full and starts to leak or dribble frequently.
Okay. And functional.
Functional is different. The urinary system might work okay, but you can't get to the toilet in time because of other issues, like mobility problems or confusion.
Ah, okay. That clarifies things. Now, what about when the problem is higher up, involving the kidneys, the upper tract?
Key signs there are often different. Flank pain is a big one, pain in your side, kind of below the ribs.
Right near the kidneys.
Exactly. Fever is another sign, often suggesting infection. Nausea can happen too.
And CVA tenderness? What's that?
Costovertebral angle tenderness. It's specific. If a doctor taps gently on your back, right over the kidney area, and it causes sharp pain.
That points to kidney inflammation or irritation.
Precisely. It's a very localized sign.
Good to know. And hematuria, the blood in the urine, we mentioned it, but it's really significant, isn't it?
Absolutely. It could be a kidney stone, scraping things, an infection, trauma, or even potentially cancer. So never ignore blood in the urine.
Definitely. Are there other, maybe more general signs of kidney trouble?
Yes. Things like edema swelling, usually in the legs or ankles.
Fluid buildup?
And hypertension, high blood pressure. Both can indicate that the kidneys aren't filtering properly, or there's an issue with those tiny glomeruli filters.
And lastly, the objectives mention oliguria and anuria. Reduced or no urine?
Yeah, those sound serious because they are. Oliguria is a significantly reduced urine output.
And anuria?
Anuria is basically no urine output at all. Both are major red flags, potentially signaling acute renal failure.
Wow, okay. So knowing all these potential signs and symptoms, how do doctors actually figure out what's going on? What are the diagnostic tools?
Well, lab tests are usually a crucial first step, and urinalysis, the UA, is fundamental.
Just a standard urine test.
Right, but it tells you a lot. They look for things that shouldn't really be there, or are there in the wrong amount.
Like protein, blood.
Exactly. Protein can signal kidney damage. Blood, as we said, needs investigation. They also check for nitrites and leukocyte esterase.
Which suggest infection.
Often, yes. Bacterial infection indicators. The UA also measures pH, the acidity, and specific gravity.
Specific gravity.
It shows how concentrated the urine is. Kind of tells you how well the kidneys are managing water balance.
Okay. And if that UA suggests an infection,
then the next step is usually a urine culture.
Define the specific bug.
Precisely. Identify the exact bacteria so you can pick the right antibiotic to fight it.
Makes sense. The objectives also list blood tests: serum, BUN, and creatinine.
Yes, those are key blood tests for kidney function.
BUN and creatinine, what are they?
Blood urea nitrogen, BUN, and creatinine are waste products. Your kidneys are supposed to filter them out of the blood.
So if the kidneys aren't working well,
the levels of BUN and creatinine in your blood go up. It's a sign they aren't filtering efficiently.
Okay. Is one better than the other?
Well, BUN can be affected by other things too, like how much protein you eat or if you're dehydrated.
Yeah.
Creatinine is often seen as a more specific marker just for kidney function.
And high levels could
point towards acute kidney injury, AKI, or maybe chronic kidney disease, CKD.
Right. And the objectives even give normal ranges for stuff in urine, like water being 95%, then urea, creatinine, salts.
Yeah, those reference values are useful. Grams per liter. Urea is linked to protein intake or dehydration again.
And creatinine in urine relates to kidney function tests too, like GFR.
Exactly. Blood creatinine is used to estimate the GFR, the glomerular filtration rate. It gives a better picture of the actual filtering capacity.
Got it. And there's one more blood test mentioned, PSA.
Prostate-specific antigen. Yes, that's mainly for men.
A screening tool for prostate problem.
Primarily, yes. Like BPH, the enlarged prostate, or screening for prostate cancer.
Okay, so lots of lab tests. What about imaging? Seeing inside?
Imaging is vital too. Ultrasound is often a first step for kidneys and bladder.
Why ultrasound first?
It's non-invasive, no radiation, and it's great for seeing certain things, like kidney stones or masses, tumors in the kidney or bladder.
And hydronephrosis? What's that again?
That's when a kidney swells up because urine can't drain out properly, usually due to a blockage downstream. Ultrasound picks that up well.
Okay. What if they need a closer look?
Then CT scan often comes next. It gives much more detailed pictures, especially good for finding smaller stones or characterizing tumors.
And cystoscopy. That sounds more invasive.
It is bad. A thin tube with a camera called a cystoscope goes up the urethra into the bladder.
So you can see directly inside.
Exactly. Direct visual inspection. Great for checking the bladder lining for cancer, stones, inflammation, or other issues.
And urodynamic studies, what are they measuring?
Those are more about function. They measure things like bladder pressure as it fills and empties, and the urine flow rate.
Helpful for things like incontinence or nerve problems?
Very helpful, yes. For diagnosing issues like neurogenic bladder or figuring out the type of incontinence.
Right. So we've covered normal function, problems, signs, diagnostics. Let's talk solutions, treatments.
Okay. Generally, treatments fall into two camps.
Yeah.
Non-pharmacological, without drugs, and pharmacological, with medications.
Let's start with non-drug options. Behavioral therapies.
Yeah, these can be really effective for bladder issues.
Mm-hmm.
Things like bladder training,
What's that involve?
gradually increasing the time between toilet visits, and scheduled voiding going on a set schedule, whether you feel the urge or not.
And Kegels, pelvic floor exercises.
Exactly. Strengthening those support muscles for the bladder and urethra. Very important for some types of incontinence.
Lifestyle changes too.
Definitely. Managing your fluids, how much you drink, when you drink.
And diet.
Sometimes, yeah. Reducing bladder irritants like caffeine or spicy foods can help some people.
Okay, what about catheterization?
That's another non-drug option.
Yeah.
Can be intermittent. You insert a catheter just to empty the bladder, then take it out.
Or indwelling.
Right, where the catheter stays in place for continuous drainage connected to a bag.
And then there's surgery for bigger issues.
Yes, for things that need more intervention. Kidney stones might need lithotripsy, using shock waves to break them up.
Or actual removal.
Surgical removal, yeah.
Yeah.
For BPH, that enlarged prostate, a common procedure is TURP, transurethral resection of the prostate. They go through the urethra to remove the excess prostate tissue blocking the flow.
Gotcha. Any other surgeries?
Sure, placing stents to hold open narrowed passages, or sometimes reconstructive surgery to fix anatomical defects.
Okay, now the other side. Pharmacological medications. Infections mean antibiotics, right?
Pretty straightforward, yes.
Yeah.
For UTIs, common ones are nitrofurantoin or TMP-SMX, trimethoprim sulfamethoxazole.
And for BPH, enlarged prostate.
There are a couple of main types of drugs. Alpha blockers like tamsulosin.
How do they work?
They relax the muscles around the prostate and the bladder and neck, which makes it easier to urinate. Kind of opens things up.
Okay. What about for overactive bladder, that urge incontinence?
For that, antimuscarinics are often used, like oxybutynin.
And they do what?
They basically block some of the nerve signals that tell the bladder muscle to contract suddenly or too often.
Right. Anything else for BPH?
Yes, another class called 5-alpha reductase inhibitors. Finasteride is an example.
And they actually shrink the prostate.
Over time, yes. They work differently than alpha blockers, targeting the hormonal influence on prostate growth.
Interesting. Pain management must be key sometimes, especially kidney stones.
Oh, absolutely. Renal colic from kidney stones can be agonizing. So, NSAIDs, non-steroidal anti-inflammatories are often used.
Or stronger stuff if needed.
Or sometimes opioids for really severe pain, yes. Pain control is crucial.
And finally, diuretics. When are they used?
Diuretics are mentioned mainly for renal dysfunction. If the kidneys aren't working well, fluid can build up in the body.
So diuretics help you get rid of that excess fluid.
Exactly. They help manage fluid overload and maintain better balance.
So, wow, quite a toolbox of treatments, really, tailored to the problem.
It really is. A comprehensive approach depending on the specific diagnosis.
Well, this has been genuinely enlightening, a real deep dive into how this whole system works.
Yeah, from normal function.
Right, the kidneys, ureters, bladder, urethra, to all the things that can go wrong, infections, stones, blockages, nerve issues, even cancer.
And the symptoms to watch for.
LUTS, those lower tract signs versus upper tract signs like flank pain.
Right.
And remembering how significant hematuria is.
And then how it's all investigated.
Lab tests, imaging, scopes.
And finally, the range of treatments, from lifestyle changes and exercises to meds and surgery.
It really gives you a solid foundation, doesn't it? A foundational understanding of, well, a really critical part of your health.
Absolutely does.
So it makes you think, considering how interconnected all this is, you know, the filtering, storing, eliminating, what aspect of urological health really strikes you as most critical for just overall well-being? And maybe what other questions does this whole discussion bring up for you? Definitely something to mull over.
Good question to ponder.
Thanks for joining us for this deep dive.